Hello, everybody. Just going to give everybody a couple of minutes to get settled into our webinar, and we will get started. Hello, everyone. Just giving everyone a few seconds to join the webinar, and then we'll get started. Hi, everybody. Just giving everybody a second to join the webinar, and then we'll get started. Okay. Hello, everyone. Good afternoon. Welcome to Cooking for Reducing Disease Risk, Plant-Based Eating and Gut Health. This program is brought to you by Northern Westchester Hospital's Center for Healthy Living, part of Northwell Health. I am Amy Rosenfeld. I am the Community Outreach Program Manager and Registered Dietitian for the center. And I have with me joined in the kitchen, Dr. Shifra Koifman. Thank you for joining us, Dr. Koifman. Good afternoon,
I guess.
Dr. Koifman is a pediatric gastroenterologist in the Division of Gastroenterology at Cohen Children's Northwell Health Physician Partners. She is also the assistant professor of the Zucker School of Medicine at Hofstra at Northwell. Welcome, so glad to have you here.
Thanks for having me.
Today, in honor of back to school month, it's a very busy time of year in September. We're going to be talking all about plant-based eating and getting into the swing of how to do that in a healthy way through plant-forward meals and talking about children's gut health and how important that is. We'll discuss the connection between gut health and plant-based eating, including what plant-based eating means, realistic cooking techniques to prepare delicious meals, and how to meet in the middle and follow what we call a plant-forward diet. We're going to explain all of that. A few pieces of business for those of you who are new to joining me in the Zoom room, and just a friendly reminder, we will take questions as time permits. Feel free to put them in the chat or the Q&A function. And as we're able, we'll answer them along the way or at the end. We'll also be answering some pre-submitted questions from registration. If your question is not answered during the presentation, you can certainly put them in the survey at the end. There will be a survey that pops up automatically on your screen when this webinar ends. Please feel free to put your question there, and or if you're interested in any referrals or to speak to a provider, you can put that information in there as well. We really respect and appreciate your opinion, so please fill out the survey. I will be tilting my screen up and down to demo recipes as we go along in the program. You should have received the recipes in your email. It came from an email address, chl@northwell.edu. If you did not receive the recipes for any reason, please feel free to also put your information in the survey and we'll be sure to get those recipes out to you. We'll be demonstrating 2 recipes today, a roasted crunchy autumn chickpea, which is a great snack, and an edamame pineapple fried rice, which is a great back to school lunch. So let's get started. To get us introduced into the topic of plant-based eating or plant-forward eating, we're going to talk about what that distinction is and give you some background about that. So when we talk about plant-based eating today, we're going to talk about the overall spectrum. We're going to talk about the connection between that and disease risk, which is part of our series, Cooking for Reducing Disease Risk, how to eat more plant-based foods and some culinary methods to do that, and then of course our cooking demonstrations. So when we're talking about plant-based eating, let's just define that because it can be a little confusing. Eating patterns that are focused on primarily foods from plants. So that means fruits and vegetables, foods that are whole grains and plant-based proteins, as well as healthy fats. So plant-based proteins, meaning legumes, nuts, seeds, tofu, tempeh, seitan, edamame. Those are some examples. And it means that the primary form of your eating is coming from these plants. And there are different variations you may have seen on social media or floating around to really help define this for us. So there are different types of plant-based eating. The first one that used to be more commonly known as is vegan. And vegan would mean entirely plant-based foods. No animal products are a part of your diet. Vegetarian could mean that you eat a plant-based diet where the majority of your foods are coming from plant-based sources, but you also intermix in some dairy, fish, and or eggs. Flexitarian could be that you are vegetarian, but sometimes you indulge in meat or meat-centric foods or meals, so that there isn't this huge emphasis on the majority of your foods being plant-based, but you also eat a lot of animal products and you eat plant-based foods. And then there's plant forward, which is what we're really going to emphasize today. Plant forward is kind of meeting in the middle here of flexitarian and vegetarian. Plant forward means that you do emphasize plant-based foods as the majority of your foods, but you're not strictly limited to that. They are what makes up the majority of your intake in terms of balance and proportion, but meat is also included. It's just not the main feature of the meal. And this is what research has shown through the Mediterranean diet and the DASH diet, some other evidence-based meal plans to be what's most effective in reducing disease risk. And the reason for that is that this type of plant-based eating, plant-forward eating, really helps to reduce your risk of many chronic diseases. It's associated with a reduced risk of heart disease, stroke, obesity, high blood pressure, so many things, even up to mental health concerns and issues like depression and anxiety. It's also linked with improved gut health and reduced inflammation, the gut health we're going to talk about in a little bit. And the reason how all of this works is because plant-based diets, diets that are mostly coming from plants, are the highest in nutrients. Nutrients meaning vitamins, minerals, antioxidants, and they are the highest in fiber, which helps to reduce things staying in our GI tract and move things along, as well as high in pro and prebiotics, which we're going to talk about today as well. They're also the lowest in animal-based fats, which have been shown to increase inflammation. So this combination of high nutrients, high fiber, and low saturated fats really is what's been shown to reduce the risk for chronic disease. Do you have to be entirely plant-based to get these health benefits? As I've been saying, no, plant forward is the way to go. And it's what research shows that really reduces the risk can really reduce your moderate risk in misspoke. Research shows reducing your risk with moderate decrease in these animal products is even efficacious. So what we recommend for children, especially growing children, is really this moderate approach, this plant forward approach to eating, where it's not all or nothing. They're getting this balance of vegetarian and plant-based meals, so they're getting the best bang for their bite in every regard. And we're really going to dive into that today. All right, so before we get to that piece, Dr. Koifman, what are your recommendations regarding a plant-forward diet as it relates to gastrointestinal health specifically?
So welcome everybody. Very good introduction. I didn't know about the flexitarian option. I didn't know that was a term, so good to know. I learned something.
Yeah.
Like Amy and I discussed, I really believe in the balanced diet for children. So neither of us are recommending a solely plant-based diet, just I want to make that clear. Because for little children, there could be risks for that with their kidneys, etc., especially under 1 with some of the pea protein and other things that are excellent, but you really have to be careful with just completely plant-based diet. So that's the first thing. I believe in everything in moderation. And the real plus of a plant-forward diet is really Mediterranean diet. So you're increasing those nutrients from vegetables and other legumes and things like that maybe kids wouldn't eat. And that helps with a lot of things with regularity. I mean, like Amy said, fiber, good fats, vitamins and nutrients to sort of alter their diet. So, they may not only eat the chicken nuggets and whatever other things, so that you have a broad spectrum that does help with your gut health, because we have a whole microbiome, which are at this point trillions. I don't even know how many of all these microbes that live in your gut, and they feed off of all these things. And there's some things that are not so good, and there's some things that are good. There's a big literature, especially in all fields in GI, especially in inflammatory bowel disease, which is a different topic, but in terms of different types of diets, Mediterranean and other things, to try and limit some of those things that exposes the microbiome, that increases your gut permeability, increases, intestinal inflammation pathway, etc. So I think a sort of a balanced diet with fruits and vegetables and all these plant-based things, with addition of meats as well, healthier versions of meat, can kind of help with your healthy microbiome and help with sort of getting complete nutrition for patients and kids.
Excellent, excellent answer. And really appreciate that explanation. So before I get to my next question with Dr. Koifman, I'm just dive into this a little bit more. So how to be a little more how to be plant-based, what we're talking about here. We're looking at thinking about your plate or your children's plate as being a quarter of the plate a plant protein, or if we're going for the meat option, the meat animal-based protein, a quarter of the plate being a whole grain or a healthy starch, like sweet potato, for example. Inclusion of some type of healthy fat, whether that be nuts or seeds or avocado or things that they're able to eat, olive oil, and then proportionately the majority of the plate being fruits and vegetables are what we're looking at and really aiming for. And this is sometimes difficult to attain, especially with children if they're picky eaters, but this is the goal, right? This is what we're working towards. So really what we like to emphasize is to
Amy, we can't hear you. We can't hear you. No.
Can you hear me now?
Yes.
Okay, I can't hear you. That's interesting. Are you talking too?
No.
Hold on, everybody. Apologize. Okay, can you hear me? Excellent. I can hear you. Okay.
Good.
Perfect. Sorry about that. My AirPods must have died. Apologize for that. So could you not hear anything that I just said, Dr. Koifman?
You started with the meals and you talked about quarter, etc., and then trying to increase things into the diet, fruits and vegetables, picky diet, and then I didn't hear after that.
Got it. Okay. Apologize, everyone, and thank you for alerting me. So it's all about thinking of reframing your perspective that meat perhaps is the side dish, not the main event, something that most children are going to get enough protein in their diet from eating a proportionately quarter of the plate of protein versus thinking about half your plate being full of plant-based vegetables, fruits, healthy fat sources, and thinking about how you can reframe your perspective to create meals along that vein, as well as reimagining their favorites or your favorites to be plant-based dishes that you traditionally have always made with meat. How can we make this plant-based? And emphasizing nutrient-rich choices, meaning that a cookie could be plant-based, right? That doesn't mean that it's a nutrient-rich choice. So making sure that you are choosing options that are going to give you the most bang for your bite, most nutrition as part of the meal planning, not just that it's plant-based. All right. So Dr. Koifman, what does getting back into a little bit of the gastrointestinal conversation we were having,
What does a healthy bowel pattern look like for children, and how can I help them develop healthy bowel habits?
So because pediatrics is a large age, anywhere from 0 to, let's say, 18 to 22, depending on what your practice is, healthy bowel habits are different. For breastfed infants, an average is 2.9 per day. Formula fed 2.0 per day. 6 to 12 months, about 1.8 bowel movements per day. 1 to 3 is 1.4, and greater than 3 is average of 1. But that being said, the mean number for greater than 3 is 3 to 14. This is from an article from 1989. So it depends on your age and stage and what you're eating. Now, usually, as long as, like for instance, a breastfed baby can go 7 days without a bowel movement, and assuming there's no pain or issues, it's okay. Formula fed, not so much. So the goal is that they should be going regularly without pain, discomfort, not clogging the toilet, not holding, straining, and things like that with comfort. So if it's every other day, but they're, doesn't seem to have pain or discomfort or other signs with that, they're not just, their belly's big, they don't want to eat, whatever, that's okay. Now, so it's a range, like I wouldn't stick to the number per se. It's more how they're doing, like, they may be going once a day, but they're hard pellets and they're clogging the toilet, or they're bloated and things like that. In terms of promoting healthy bowel habits, so with children, constipation is sort of runs the gamut, and it can vary. So yes, I do recommend that they have like sort of a balanced diet. Excessive amounts of lactose in some kids can cause constipation. I'm sure a lot of you have experienced when you go from even a cow milk based formula, sorry about that, or breastfeeding with exposure to dairy, then moving to whole milk. A lot of kids seem to get constipated. It's probably the way it's manufactured, etc. So some of the exposure to dairy can have can increase hard stools and less frequent and pain and discomfort. So if there's excessive amounts of dairy, that could do it, but not always. Not every kid who drinks like the average amount of milk or yogurt or cheese will be constipated, right? So I would say a balanced diet. Fiber does help, and good fats, etc. For evacuation. But the other thing with a healthy bowel habit, especially with kids, because a lot of the issue with constipation is withholding and fear. It's having them sit on the toilet regularly after meals, and we can discuss that later. But we're going to talk about constipation later. But some of that, the healthy bowel movement, healthy bowel habits, has to do with sitting and the right seat, etc., and the food also. So it's all kind of comes together.
Interesting. And what about probiotics? Would you say that has an impact on a healthy gut, especially for children? Would you recommend that children take supplementation, or do you encourage people to eat foods rich in probiotics, especially children?
Probiotics is a super hot topic. It's a burgeoning field, the microbiome, how many, like trillions of species. Unfortunately, or fortunately, it's super complicated. It's not just about, there's good strains or bad strains, but then it's not just about what strains you ingest, but how those interplay with each other, what kind of things they make, how they feed off each other. So it's really complicated. I will recommend probiotics in certain areas when I know there's some Cochrane-based or evidence-based reviews. That being said, that's limited. I would say start with natural probiotics like kefir, sourdough bread, kimchi, sauerkraut, some of the softer cheeses, yogurt. Some of those, there's buttermilk people recommend, and things like that have some natural probiotics.
Mm-hmm.
In terms of supplementing with like specific ones, it really depends on what the symptoms are, etc. It's not really regulated by the FDA because it's a medical-based food. So the amount in there could be 100 million units, 2 million. It varies. There can be contamination at times because it's not as regulated. That being said, it's, I think, fairly safe depending on the age. Like if they're little or preterm or whatever, it's a different ball game. But I would say consult your local physician for advice on when and if to take like probiotics that are manufactured, I would say start with the naturally occurring ones first.
That's good advice. And most people don't realize that supplementation isn't regulated by the FDA, right? It's not something
Correct.
that is carefully monitored. So supplementation isn't necessarily always a safe bet. It's definitely good to talk to your physician about it. And the natural route is always harmless. So it's definitely good to emphasize, like you said, the natural sources of food. And what about, you hear a lot speaking on the trendy side of gut health. What about the brain gut connection? You hear a lot of talk about that with adults. Is there that in children? And how do other factors like sleep, stress, and exercise intertwine with all of that, if there is one?
Sure. So I actually did 2 years of basic science research during my fellowship with Dr. Alan Goldtune, who is a pediatric surgeon, amazing guy, brilliant guy, NIH funded, was a pediatric surgeon and worked, as a physician, surgeon in chief, and had an R01 funded lab. So I learned a lot. The enteric nervous system is 200 to 600 million neurons. We really don't understand much. At the time I was there was one lab devoted to enteric nervous system in all of Harvard. They have like 15 different biology majors or something. So, and the scientists around the world it's still a burgeoning field. There's a lot we don't understand, but there's huge interplay between what's called the enteric nervous system, which is nervous system within the GI tract. Then you have your like central nervous system, right? Your brain, your spinal cord, and your autonomic stuff like your reflexes. All of that is interplay, right? And then you have your hypothalamic pituitary axis, like, if there's stress, you can increase your glucocorticoids, which can increase your sympathetic or your like fight or flight response, which increases, inflammation, cytokines like that can interfere with the intestinal permeability, the microbiome, etc. So all of that does play a role. Sleep, helps restore your circadian rhythm, and abnormalities in sleep and disorders in sleep can affect your microbiome as well. So I would say that healthy sleep pattern can help with the sort of keeping your sympathetic nervous system, your like fight or flight modality to a minimum and shift it to more of the rest of the digest modality. Exercise increases endorphins and other other neurotransmitters in the gut. And we know that neurotransmitters played a huge role in the brain, but also in the gut, like serotonin is a big one in the gut. And so helping, promote some good or bad endorphins and sort of decreasing your sympathetic nervous system and increasing your sort of vagal tone can help with gut health, because all of that is interplayed. Like the brain interacts with the entire nervous system. So it's important to get enough sleep and, try and reduce the other things that can affect you negatively. Obviously, that's very hard.
So fascinating. And I'm sure we'll know in 10 years from now, the emerging science that will come out of all of this will really be so enlightening. There were some questions in the chat relating to book recommendations to learn more on the topic. If you have any recommendations, would you be able to put those in the chat for everybody? I think that would be...
There's one about the second brain. There's a guy, Mike Gershon. He actually wrote a book too. He's like one of the gurus of enteric nervous system. There's like a video on Amazon Prime or Netflix, I always forget which one, about the second brain, just to learn about it. It's like 45 minutes, and he wrote a book as well. There are many on the topic. I do need more of the sort of the academic side when I was doing my research, which was probably on the nitty-gritty side, but that's the first one I could recommend. And then there's a lot of stuff, but Mike Gershon is one of the big guys. So maybe start with something like that.
Excellent, thank you. So we're going to take a little pause from our questions and dive back into the plant-based stuff, as it completely relates to gut health, talking about, as you mentioned, high fiber. When we're talking about children, like you mentioned with probiotics and really being cautious, there are some other key nutrients for plant forward kids, and especially plant-based kids, which again, we really recommend plant forward as the approach to really emphasize the inclusion of healthy fats and whole grains at most meals and snacks for meal satisfaction, as well as for caloric intake. We really want to be sure that they're getting enough calories in their day, as well as enough fat for brain development. Plant-based foods tend to be lower in fat and calories. So you want to be sure, especially if you don't have a big eater, that each bite they take is what we call nutrient dense, calorically dense, in the right types of calories. The key nutrients, people, there were a lot of questions and pre-submitted questions about this on registration. Vitamin D, zinc, iron, calcium, and vitamin B12 are the key focal nutrients when going to more of a plant forward or plant-based diet. Vitamin D is something that we actually make through our skin from the sun, but those of us, wearing sunscreen more cautiously, sun aware, that isn't, or living in the Northeast where this program is being filmed from, don't get a lot of that sun time on most months of the year. Fortified vitamin D products, as well as mushrooms, are a naturally occurring vitamin D rich food, good to include in regular rotation. B12 is something that is mostly found in animal-based products. And again, that's why we recommend this forward way of looking at things, or meal planning, so that there is some integration of animal and meat-based products. But nutritional yeast, which is a really great substitute for Parmesan cheese, is a naturally occurring source of vitamin B12. I'll put that onto popcorn, for example, and it's a really great way to get nutritional yeast in for children. Iron, there is a lot of what we call non-heme iron, which is non-animal iron sources. Legumes like beans and lentils, as well as pumpkin seeds, are particularly high in iron. Quinoa, tofu, and green, especially dark green leafy vegetables, are rich sources of iron. When you are having an non-heme iron, you always want to pair it with something that's high in vitamin C. Vitamin C helps to absorb non-heme iron. So tomatoes, strawberries, peppers, oranges, any of the citrus fruits, kiwis, pairing them together, eating them in the same meal will definitely help to boost the absorption of iron from these foods. So for example, a tomato sauce, adding some spinach to it, you're going to get the absorption of iron from the pairing there. Calcium, tofu, edamame, dark green leafy vegetables are great. You do not need to have dairy in order to have these things, as well as fortified milks. And zinc, similar to iron, in similar types of foods, you're going to get animals, sources of zinc from non-animal products. And as we talked about with Dr. Koifman, the fiber intake, all of these things are really wonderful for you. But increasing fiber, I always want to use a word of caution. That means you need to increase water too. If they don't go hand in hand, it can definitely cause gastrointestinal concerns, right? Would you agree with that, Dr. Koifman?
Yes, I would.
So making sure you're well hydrated, your child is well hydrated. Thinking about urine color is a good way of looking at that. Urine running clear or pale yellow is an indication of hydration versus how many glasses. We've shown that it's more about individuality versus the number of glasses. And then just thinking about from a culinary perspective, really want to replace what's called umami for meal satisfaction. So umami is the meaty taste of foods, essentially. So I can also, when we send out the recording to this program, send out the link to this presentation so you can get all of these ideas. Plant-based ways to replace umami, there's a number of them, and that really help to give you that meaty meal satisfaction without the use of animal products. All right, so we're going to start with our first cooking demo, and then we'll ask some more questions. You up for that, Dr. Koifman?
I am. I'm trying to answer some of the questions in the chat, but I think I may just address them at the end because some of them are really complicated answers.
Okay,
So
no problem.
I started to answer, but at the end, I think I'll go through some of them.
Okay, excellent. Some of them are directed, I think, well, I can't see all of them, but that will be great for you to do that.
Some of them are directed at me, I think.
Excellent.
So,
okay. All right. So our first recipe today, we're going to be making a snack. People always ask me for snack ideas for their kids. This is a true snack for anybody. And it's great for the autumnal flavors we're getting into now. It's almost pumpkin season. I'm about 2 days shy, so forgive me for those of you who are not quite ready for fall. This is a crunchy roasted chickpea recipe with autumnal flavors. Now I want to emphasize that you can make this your own with any flavors. I'm just showing you my version and we'll talk about that. So I'm going to tilt my screen down so you can see what I'm doing. Okay, I'm going to turn the spotlight on so you can really see. There we go. Okay, so I have in here some canned chickpeas that I rinsed and drained. As you can see, they're nice and dry. That's really important for this. And if you have any chickpeas, once they've been sitting on paper towels, drying out for, I'd say about 20 minutes or so, sometimes the skin of the chickpeas will start to peel away, as you can see with this one. And to make it like you don't have to do this with every one, but it's really obvious, to make it the perfect crunchy chickpea, you just want to peel that skin away and discard it. But you also don't have to do that part. So this is a great gluten-free, high protein, high fiber, high nutrient rich snack. It's kind of a replacement for chips or some other type of crunchy snack food that your children might love. So you want to start by using really good olive oil, and you're going to coat your chickpeas in the olive oil. This is, again, inclusion of really healthy fats, and it's going to help with the roasting process. So I'm going to mix that all up and make sure it's in a single layer. And I preheated my oven to 400 degrees. They cook for about a half an hour, shaking the tray every 10 minutes or so to get even cooking. And when they come out of the oven, through the magic of television, I can show you, they turn this like dark brown color that's really crunchy. And you want to, while they're still hot, coat them in the toppings. It is ideal to wait while they're still hot. Now, for our purposes, we're going to make these sweet, but you could do it in any way you like. You could make them just salty. You could make them with spicy, with smoked paprika and cumin. You could make them cheesy with nutritional yeast or Parmesan cheese. You can do this however your family likes best. So for a sweeter one, an autumnal taste, I'm going to use a little bit of high quality maple syrup. Maple syrup that's all natural. It's kind of like my glue for this recipe. I'm tossing it in the maple syrup. And then I'm going to put my seasoning. And my seasoning here is pumpkin spice, cinnamon, and a little bit of brown sugar for texture, but just a little bit because I've already used the maple syrup. And I'm going to coat it really, really well and toss it again. Do another layer. And these last in a container on your counter or the pantry, airproof container, for about a day or two. They don't usually last that long in my house. And there you go. This is a great alternative if you can't have nuts, or if your children can't have nuts, or if you're just looking for a different variety. You can also mix them together in a trail mix. That might be really interesting. The sky is really the limit, and no need to purchase it. You can make these really easily yourself. How do these
That looks delicious.
Yeah?
Gonna have to try it at home.
Are you ready for fall? Are you anti-pumpkin at this point?
I like pumpkin. I like the gourds and that kind of thing.
Excellent. Excellent. All right. So getting back to you, Dr. Kreisman, and your questions. When we talk about gastrointestinal health, let's talk a little bit about conditions and sides of things. What are common gastrointestinal conditions that you treat in children?
So as a pediatric GI, there's a very large range. I'd say the most common referrals are for reflux for babies, milk protein intolerance, constipation, what's called encopresis, so like soiling, reflux in older children, a lot of sort of irritable bowel syndrome or, hypersensitivity or abdominal pain. Then we treat celiac, which is unfortunately becoming very common. And then, inflammatory bowel disease, liver disease, non-alcoholic fatty liver disease is unfortunately becoming pretty common. Other types of liver disease, kind of runs the gamut. But I'd say the big ones are constipation, abdominal pain, reflux in babies, milk protein intolerance. The big ones, I would say.
And so going through each of those, like diving a little deeper, I know you talked a little bit about constipation before, but what are some tips and tricks you can recommend for parents to help establish regularity for children who really are suffering from constipation?
So like I said before, in children, constipation, it's very complicated and many different terms depending on if they're withholding, retentive, functional, meaning there's no real source. If you have like celiac or thyroid issues or electrolyte disorders, that can lead to constipation. That's more sort of organic. If you have what's called Hirschsprung's disease, which is an absence of nerves in your colon, that can lead to constipation. Issues with like the nerves in your GI tract functioning, those kind of things, neuropathy or things like that in the enteric nervous system. Those are more, those are things that are developed within the architecture of the gut that can cause constipation. I would say the predominant causes of constipation, usually in my experience, is when there are changes in their diet. So when you introduce solid foods, age 2 to 3, when you start potty training in school, leading to withholding or fear, and then, retentive sort of holding in their poo, and then that leading to constipation or harder poo. I think that's more common in kids. Of course, there are kids that are really not eating the right foods and they're really, devoid of fiber and they're drinking a ton of milk and things like that. And that does happen, but I don't think that's predominantly the cause of constipation. I think it's sort of multifactorial depending on what it is. Obviously, if it's a baby and things like that, if they're not breastfeeding, and it's early on, then that's something more urgent depending on what it is, because you want to make sure that there's no nerve issues like in the colon. So in terms of regularity, like I was talking about before, I do think the plant-forward diet, meat in moderation, but introducing your kids to legumes like farro and quinoa and all those other things, that introducing them to those other types of things that are high in fiber, high in protein, other things do help them. So you have more regularity. The other thing is having them sit on the potty regularly. Now, obviously potty training is a big thing. My daughter is 4 and, she was potty trained for urine before 3. And even as a GI doctor, a pediatric GI doctor, I could not get her to go to the potty till at least 3.5. So, even I struggle with things like that, just so you know.
Comforting.
Sometimes they just have to be ready.
Yeah.
But sitting them on the potty after eating, having a little stool even, with kids, little potties, it's harder, but a little stool that sort of changes the angle of your pelvis. When they're having issues, even in the pull-ups and diapers, to have them squat so they're not all contorted, so to help with the pelvic floor, have it come out easier. So those are certain things. And then having them sit on the toilet maybe 10 minutes after eating meals probably is the best idea. So because when you eat, you have to clear out all the feces to make room. So that's the best time to sort of get things out. And then there are some techniques I use with kids who have harder stools and constipation in terms of blowing and sort of relaxing the pelvic floor muscles. So I guess there's a big gamut of different things depending on what it is.
Okay.
Yep.
And also hydration and exercise, would that also be?
Hydration is important and exercise is important because that increases, we deal with endorphins and other neurotransmitters, et cetera, and that does stimulate your, movement of the gut. So water and things are important as well.
There's a question that just came through: how much water should a 3-year-old drink per day? Do you have a recommendation, or do you go by the hydration levels of urine color like I was talking about before?
So if they're dehydrated, there's certain formulas depending on their weight, etc. I think the urine color is probably a better bet. because I mean, some kids need 3, some kids need 4, some kids need 5. I think it's a varied thing, and I don't know as a nutritionist what you recommend. I'm curious to hear your thoughts.
Yeah, my thoughts are definitely that it's individual, especially depending on how much they sweat and their activity level. And
Right.
like I have one kid that's always runs hot and is really active, and he's always sweating, and he needs to drink more than my other child who's less like that. And so hydration and urine color is always a safe bet, in my opinion, as well as introducing the concept of drinking with every meal and snack, and making sure with physical activity there's lots of liquid as well. But it's not a hard, even for adults, it's not a hard and fast recommendation. Some adults need 7 glasses, some adults need 12. Kind of depends.
Right, it depends on your other things, if you have intestinal, but like if there's other things going on.
Exactly. What about reflux? What do you do with children who have reflux? Are there some lifestyle remedies that you recommend with that?
So reflux, like I said, there's reflux in infants, which I think is a different category. And that's more of, an immaturity / where they're, if your esophagus and then your stomach, you have your diaphragm. So where that esophageal gastric, the GE junction, the gastroesophageal junction is, they have more contents coming up and down more frequently. So with infants, it's more of a physiologic / I think more of a immaturity thing that eventually grows out with time. I mean, some of them sort of sticks with them for a little bit, and some of it goes, most of it usually gets better with time. If they're premature, etc., it could be longer depending on if they have surgery, whatever. Then children, I would say, like toddlers and older also get reflux. There's also a lot of children will get like a post-infectious, either they have a reflux or they have some irritation, or sometimes they have what's called dyspepsia, which is like a pain or discomfort that's not necessarily reflux. Sometimes it's hard to tease out. In terms of lifestyle remedies, there is some evidence about, decreasing the fatty foods and some of the spicy foods. I mean, I've seen kids, like there's a snack called Takis, which I'm sure some of you are familiar with, which is horrible and full of with all kinds of spicy, and it can cause just reflux from just that alone, just because of the ingredients, etc. So some of the foods, trying not to eat too much before bed. Depends. Sometimes some kids need more frequent meals also. Things like that. Yeah, so avoiding the high fat and the citrus. But I mean, when I say all these things, you have to be careful, because when we start restricting diets, I see this all too much, that then we ultimately develop things later with restricted eating and things like that. So in moderation, if it doesn't work, if you restrict that stuff and they don't feel any better, I wouldn't continue that, right?
Right. And it's very individualized and a lot of guess and check work.
Yeah, there's a lot of individuals. What's reflux, those acids, it's actually pretty complicated. Acidic, non-acidic contents, acidic contents. Now we have something called manometry, which looks at the pressure and looks at the contents coming up to see if it's acid, if it's non-acid. There's all these what's called functional disorders. So it's actually super complicated, and they're going to revise the guidelines now. The gurus and like esophageal motility are going to, kind of change some of the guidelines. So it's pretty complicated, I would say. But yes, dietary changes can help. Medication, acid medications can help. There's some, medical foods that can help depending. And then, depends.
And what about abdominal pain? Just like general tummy pain or a chronic abdominal pain?
So we see that often. I mean, chronic would be at least more than a month, usually more, depending on the definition, 3 months, 2 to 3 months, depending on how many times a week, etc. I do see that often. Unfortunately, in the COVID era, and I mean, any virus and infection can trigger that, but we saw quite a bit of that, this post-infectious pain. It's basically chronic, that you really don't have a source, right? You do your labs, there's no celiac, there's inflammation, blood counts are fine, inflammatory markers are fine. Sometimes they do an endoscopy and colonoscopy, and all that stuff is normal. And their enteric nervous system and their gut brain axis with their central nervous system, etc., there's some sensitivity there. And as they're more we're still trying to figure that out in terms of the neurotransmitter imbalance, et cetera. Some people have different pain thresholds, et cetera, and it's super complicated. I mean, probably need a PhD on the topic and still not enough. So I do see that often. It's just chronic pain that's present for at least a month. That's sort of not, no laboratory / testing has kind of come up with another source, but they do feel pain and it doesn't interfere with activities and maybe they don't want to go to school, et cetera. So it's a pretty real thing and it's, very difficult for families.
Mm-hmm. I'm sure difficult for treatment as well, since there's no.
Depends, but yes, I have several friends who are going through similar things now and it's kind of tough. So I totally, it can be very hard even if there's no specific diagnosis.
Mm-hmm. And then of course, last question for the all too common topic of intolerances or even potential allergies like celiac. How do you deal with all of that, and how does that affect gut health as well?
So we'll talk about celiac in a minute. That's a whole topic. So I think food intolerances are a little bit hard, and I think it's definitely tough for families because even with the allergy testing, the skin testing, there's the blood testing, which is called the immunocap or IgE or RAS testing, and there's skin prick and patch testing. The blood testing, if you talk to most allergists, it's variable, et cetera. It's sort of not helpful. I personally don't order as a gastroenterologist anymore. If there's concern for a food intolerance, I'll just send to allergy for possible skin prick testing, et cetera, just because maybe it doesn't always contribute. And then often sometimes will lead to restrictions of things that don't need to be restricted, which is a problem because we do need to be exposed to those antigens, et cetera. I think that's important. Now, in terms of intolerance, so I mean, lactose intolerance, I see a lot of, I think it's pretty common with age. We're the only mammals that drink milk after we're weaned. So I'm sure you have friends or people, or you yourself have done paleo or something like that and feel much better. Probably dairy doesn't do great with us, but it's an easy source of fat and protein and it's easy and on the go, which is why most of us use it. So lactose intolerance is one that we see a lot of. That you can do a breath test, or even if I do an endoscopy, you take a little tissue sample, send it to the lab, and they can test for that. There's something called milk protein intolerance. So I'm going to go through this because I think it's a big, it's confusing for a lot of people. There's lactose intolerance and there's the milk protein intolerance. Lactose intolerance is the sugar that's in the milk. We have on your intestines, you have little villi. On the top, they have disaccharidases, so enzymes that break down two sugars that are linked together. Lactose is one of them. And when you get with age, or even if you have an infection or even Crohn's disease or celiac, those enzymes could be lower. And so your body has trouble breaking down that sugar. So the bacteria there break it down, you get bloating, gas, diarrhea, nausea, whatever. That's one. Milk protein intolerance is the actual protein in the milk that can cause discomfort, whether they have an allergic reaction, like they have hives, et cetera, or an intolerance where your body just can't handle it. So they're different. Now, some people are super lactose intolerant, can't take any milk. That's a different story. Then in terms of celiac, we'll go into that like I talked about. In terms of gluten intolerance, this is a big one. There's really no testing for it. They're working on certain, blood markers, urine markers, et cetera. It's more of elimination and sort of symptom relief, but it does, gluten intolerance does, non-celiac gluten intolerance does exist, and it can affect different things, migraines, et cetera, all kinds of things. So, like I said, talk to your local, GI or your personal physician about things like that. You have to be careful about eliminating foods from your diet because like with celiac and gluten, it has a lot of the wheats and the cereals and are fortified with vitamins and minerals. So then, and gluten-free products have a lot of fat and other things in them. So everything has to be done in moderation. There's no quick fix. And the other digestion issues, I would say keep a diet log and then try and figure it out. It's not always so clear. And sometimes it takes some digging, etc. So
Right.
I would say there's a lot of added sugars these days and a lot of things, which causes some of them are broken down and I think can definitely cause some issues, which I'm sure Amy can address as well. But I think that's also something to look into, and all the additives that's something I wanted to ask about plant-based stuff in a minute.
Exactly, definitely. And having as many, that's why I think programs like this showing you how easy you can make simple recipes from a homemade perspective for kids as best as you can to, especially if there are food intolerances or issues going on, the more you can control it, the more you can narrow down the concerns and pinpoint what exactly is causing the issues, rather than just full on eliminating, like you're saying, which can cause a whole host of other problems. I do want to dive into celiac, but I want to make sure we get to our recipe here. So if we take a pause and get that going, and then we can talk about celiac. And I see there are a couple other questions as well. Is that all right with you?
Sure. I think is it easier for me to address them on the chat or live?
Yeah, I think you can address them in the chat. I know there was a question about antibiotics and probiotic usage. I think that would be great to address to see whether or not you recommend taking probiotics with antibiotics. But I want to make sure we have enough time for our recipe. So I'm going to tilt my screen down here, and then we can ask our last question about celiac. There we go. The recipe we're going to make here is great for school lunches, easy dinners, and it's perfect, fast, plant-based meal. This is a edamame fried rice. Oh, let me make sure I get that up on the screen there. There we go. So it's going to be an edamame pineapple fried rice. And this is a great one. It's loaded with nutrition. It's loaded with color, and it's fried rice is always usually an accepted food for most children. So I have in here some sesame oil, heated up my pan. Sesame oil gives it like just an interesting different flavor, but you could use whatever oil that you have available to you to do this. For purposes of television, I took my canned pineapple and I pre-seared it. So you don't have to do this step, you could skip it, but I put them in the pan and seared the pineapple to caramelize the sweetness and make sure that it really enhanced the flavor a little bit more than just regular canned pineapple. But you can skip that step entirely, as I said. I also used frozen pre-shelled edamame beans, which I've already also seared, and some frozen broccoli, which I seared in the pan ahead of time for eases of this recipe demonstration. But again, I'm trying to use things. This is a very affordable recipe. Everything like canned pineapple, frozen broccoli, frozen edamame is a very, very affordable recipe for those of us feeling the feelings of inflation these days. I also have pre-cooked brown rice here, which you can actually buy now, pre-cooked brown rice, if that's something you prefer to skip a step, or you can just make this part ahead of time, maybe the night before. So
I used to buy that all the time from Trader Joe's. That one, and there's another one in Whole Foods has also.
Exactly. So this is just plain steamed brown rice. You can put in the pre-cooked, or you can make on the stovetop, just simple steamed brown rice. You could also mix up the grains here. You could do, sometimes I'll mix in a little bit of quinoa into it, or I will mix in another grain to make it a multi-grain fried rice. If you are transitioning to whole grains, like your family isn't so into it yet, you could also do half and half, some white rice with some brown rice. It's a really nice way to transition in versus just going full steam ahead with brown rice. And it's very, that's how I introduce new grains to my kids, is I'll mix them with brown rice. So they aren't just eating a bowl of quinoa, they're getting it mixed in with something that they've already accepted and love. So once you've gotten the rice nice and hot and mixed with your sesame oil, then you're just gonna mix everything together. This is why this is such a fast recipe. I'm gonna use tamari, but you could also use soy sauce. I use low sodium to make sure that the salt level is nice and low. You could also use liquid aminos if that's your preference. That's another substitution.
Pardon my ignorance, what is liquid aminos?
Liquid aminos is very common in the plant-based community. It tastes exactly like soy sauce.
but is completely plant-based, and it actually tastes no different than soy sauce.
Got it.
So
And
now
what's the advantage of tamari? Like, is it have a different
tamari
flavor?
is gluten-free.
Got it.
Tamari is gluten-free. So I have in here now all of my vegetables, which again, I've pre-cooked. If I wasn't pre-cooking it, I would have cooked that first and then added my rice to the pan. Mixing that all around. Gonna add my pineapple in. And again, the citrus, the vitamin C rich pineapple is gonna help us with absorption of the iron and the other nutrients in the broccoli, but especially the iron. And it's gonna give that sweet and salty that kids really respond to and really love. And then this would be the plant-based version of it if you wanna stay solely plant-based. But for extra protein, I highly recommend adding some scrambled egg. And this is where the plant-forward, flexitarian realm or way of thinking adds to it. That's going to give them a little extra protein boost and a ton of nutrition from the egg. You could skip that step, but you also could add it in, and that's perfectly fine. And that's pretty much it. So I would take this recipe and make it in a large batch, either for, say, dinner ahead of time or for school lunches, and put them in, heat it up, put it in thermoses. It would be hot still for early lunch hours. And just a really simple, affordable meal that you can make your own. You could skip the pineapple completely if that's not your preference. You could add different fruits, different vegetables, different grains. It's just a method. What do you think, Dr. Quickman? Would your kids eat it?
I hope so. I'm gonna try and make it.
Or would you eat it? We
Me?
sometimes
Sure.
love it as a family meal for sure.
Yeah, I mean, I make a version of that. It's, you know.
Yep, exactly.
just
And that's
pineapple. Never thought about the pineapple if it had mommy, but
the sweet and the
sweet,
savory
salty
is a
thing.
really big hit with the kids for sure.
of course.
Sweet savory. So I think we have time for any last questions and or the celiac question. So maybe you want to talk briefly about that. Seems like there aren't as many questions in the chat that haven't been unanswered. It seems like
Yeah, there are some questions that, like, what leads to unhealthy gut? I mean, that's a really long question. That would probably take hours. So I can't really address that in this talk.
Yeah.
Like I said, there are a lot of moving parts for all of these things. Somebody asked about antibiotic-associated diarrhea. There's some evidence about lactobacillus GG or some probiotics helping with antibiotic-associated diarrhea. Probably starting with some natural probiotics is probably ideal. But like I said, I mean, for the most part, probiotics are safe, but just so you know, because it's a medical food, it's not FDA regulated. It might not have the amount, et cetera. They could have they could have some contamination, but that happened with formulas that are highly regulated. So there you go.
Yep.
In terms of celiac, I'll talk about that a little bit. I am seeing that a lot. I mean, last time I did endoscopies last week, I had 2 kids. I feel like I'm doing it a lot more these days. I can't comment to why. I think, first of all, pediatricians are screening extensively, mostly to make my job easier, so that by the time you go to a specialist, if there's a 3-month wait list, you have everything, you go straight to endoscopy or whatever. Celiac is an autoimmune disease triggered by gluten. It's the only one we know, only autoimmune disease that's the trigger is known, which is a big deal. So what happens is that the gluten sort of triggers this, you know, you have it causes intestinal, your gut is leaky, the connection between the cells of the intestine are somewhat loose, and the gluten comes in for whatever reason, if the microbiome, et cetera, permeability from other reasons, and really don't know. Microbiome, et cetera, I think there are a lot of theories, but I don't think we know 100%. Things come in, and basically it triggers this whole cascade, leading to your white blood cells kind of acting up and then affecting your intestinal tract. It affects your entire body. Okay, so even if your child is asymptomatic and you have a first degree relative like parents or siblings that have celiac, everybody needs to be screened because it can affect, I mean, if untreated, you can have anemia. I mean, back in the day, they had heart failure, growth failure, fertility, bone issues, central nervous system issues. It can affect many things, lymphoma. I'm not to scare anybody, but it can affect your entire body. So if there's a first degree relative in the family, meaning of a child, parents or siblings, someone directly related to you, I do recommend getting screened, okay? If they're under 3, that's a whole topic, probably not unless they're symptomatic, because under 2, the antibodies aren't reliable, etc. It affects gut health because basically, you know, gluten comes in and then basically activates this whole auto inflammation of the gut, of your own gut. And that could lead to, I mean, basically your intestine, your small intestine, your villi kind of look like this. It's flat, you don't absorb things, then you have malnutrition issues, et cetera, et cetera, et cetera. It's 1 in 100 these days. Not sure why, if it's the processing, if we're screening more, who knows? But, you know, it does affect the whole body. So that's something that people need to be aware of. Now, eliminating gluten in somebody's, in kids, that we talked about, I think you have to be careful. You can try it for certain things, what, you know, under the advice of physician, or if you want to do it on your own, I guess, but you have to be careful when you eliminate gluten because like the vitamins and minerals, the government fortifies a lot of things. And like I said before, those gluten-free products have a lot of sugar and fat and other things. So eliminating gluten may be an option for your children, but I wouldn't do that lightly, and making sure that they're otherwise getting the nutrition otherwise. That's an important thing.
Right. Well, thank you, Dr. Koifman. That was really informative. I think we learned a lot in this hour from each other and sharing information with each other. I hope everybody enjoyed the program today. There will be a survey that pops up automatically on your screen. We really hope that you fill it out because your feedback helps support these free programs for the community. If you are interested in getting any additional questions answered or referral to Dr. Koifman, you can put that information in the survey. You can also call 914-458-8800 for referrals to all Westchester pediatric specialties. And we thank you very much for joining us today. And thank you, Dr. Koifman, for being in the kitchen with me.
Thank you so much for having me. I'm in Chappaqua and Terrytown, so just so you know. Or Sleepy Hollow, excuse me. Sleepy Hollow.
Excellent. It's hard to remember where we are these days.
I mean, you cross the border and it's Sleepy Hollow, so technically Sleepy Hollow.
Excellent. All right. Well, everyone, thank you so much. Take care and have a wonderful day.
Thank you so much.